Wow.
We'll call the special work session March 16th, 2026 to order. Guess we don't even need a motion to approve the agenda because it's a work session. Okay. So it's the health and dental insurance renewal. IMA, Nick, you're going to go over your, okay.
You want me to stand it up here?
Yes, that way we can maybe hear you. You're about my height.
And I do have printouts. Does everyone have theirs already? Do you want me to hand those out?
Is it the same one we had before?
It is different, a little bit different.
I just filed mine away and I don't have it.
Well, I will make sure everyone has it.
In there, new one. Stapled. Yeah. I think I've got it. Yeah.
I think that's what I've got.
Well, that's what I have. Sorry.
All right. Well, thank you all for allowing us to come out here again. You guys are just stuck with me today. Ryan, unfortunately, couldn't make it, but really just to kind of kick it off, really kind of a recap of the renewal this year. So the self-funded renewal came in at a 6.3% overall increase. It's about $312,000 when we're looking at expected costs, current expected costs to renewal expected costs. What makes up that increase? The admin costs are staying flat with Blue Cross of Kansas, so no increase there. There is a 35% increase on the stop-loss premium. Unfortunately, it is a pooled product, and the reason for that large increase is how the Blue Cross stop-loss pool is running this year. And then when we look at your claims utilization, this is based on really your last 3 years of claims. And so that's coming in at a 2.1% overall increase. And then we did reach out to Blue Cross, especially given this year and the financial constraints. We did have a fairly competitive option from the market to try to negotiate a concession for this year. Unfortunately, the last 3 years, they have passed on a concession to you all in lowering your admin rates. Because of that, they really submitted that, hey, this is their best and final this year. We have a lot of options that we went out to review this year, both with Blue Cross, the market. We looked at the state employee health plan, and then received an alternative option from Freedom as well. And then looking at dental, the good news about dental is that's coming in at a slight decrease, so 2.9% overall decrease on dental. If you flip to page 3, this is just a quick renewal landscape. Hit on a lot of this already, but the medical on its own is getting a 6.3% increase, dental at the negative 2.9%, and then the nice thing is your group life, voluntary life, vision, and EAP. All of those lines of coverage are receiving a rate pass or they're under rate guarantee, so there will be no changes on those lines of coverage. Page 4 is really kind of our marketing summary and looking at all the different options that we reviewed this year. Really, the first handful that we're looking at on page 4 didn't really make sense because they're moving you to a non-grandfathered plan design, which means you have to cover preventative services at 100%, so they're actually increases. We do have some options below that that really range from a slight decrease to about a 1.2% overall increase, and that's where we're going to focus the majority of our time today. And then also reviewing moving to a high deductible health plan. Based on our conversation last time, we all kind of talked about that'd be a pretty substantial change to employees, and the financial savings just weren't necessarily there for that. Also reviewed moving from a self-funded plan to a fully insured plan, which that came in pretty significantly higher, about a 16% increase over the 6. So we move to page 5. This is really the options that we wanted to highlight with Blue Cross of Kansas. And so you'll see option 5 that's listed there. which would be increasing your deductible from the 200 to 500. It would be increasing your maximum out of pocket from 700 to 5,000. And this is more of kind of a standard plan that we typically see. Still pretty rich with that $500 deductible. And then it also introduced copays to the plan. So $25 for your office visits, $50 for specialists. ER would have a $250 copay. And then the other big change would be moving drug formularies. And so you'd move from the select formulary, which is more narrow. There's more access to drugs on that select formulary, to the Results RX formulary, which that drug formulary is a little more strict. There's a little less drugs that you can fill on there, but it does a better job of containing pharmacy costs on the plan. And then it also introduced a 5-tier copay card, which would be different than your current 2-tier structure. Overall, that option reduces the renewal from a 6.3% overall increase to a 1.2%. It's about $255,000 in savings. Options 6, 7, and 8 are all $1,500 options. 6 is quoting the select formulary and really kind of mimicking your current plan as close as possible, but really just bumping it up to a $1,500 deductible. That came in at a 2.7% overall increase. Option 7 is really the same exact thing as option 6, but it's moving to the Results RX formulary 2. That saved you about another percent or so, about 1.5%. Option 8 is the $1,500 deductible with the $5,000 max out of pocket. Still introducing those copays, but keeping you on the select formulary. It's about a 2.4% overall increase. And then option 9 would be the $1,500 deductible up to a $5,000 max in the Results RX formulary. So really options 5 and options 9 are the exact same. It's just a different deductible amount. So you'd have a $500 deductible and a $1,500 deductible. And one thing that we talked about last time that I think picked up probably the most traction is offering that as a dual option. So you could offer both of these options to your employees. So you could offer the $500 and then the $1,500, and then you would have different contributions for those options, and then employees get to pick which option they'd prefer to enroll in.
Nick, one question there.
Yep.
Like on option 5 or 9 on co-insurance out of pocket, we've got not applicable, and then we've got a total out of pocket.
Yep.
What's the difference between that and what we're seeing on option like 6?
Yep. So option 6 has a $500 co-insurance out of pocket. And so the way that would operate is you'd have a $1,500 deductible. Once you hit that $1,500 deductible, that's when the co-insurance kicks in. Members would pay 20%, and then they'd pay 20% up to $500. And then they're capped after that. The only way that they can get to that other out of pocket is copays.
Okay.
So essentially they'd pay that $1,500, they'd have a $500 co-insurance out of pocket, and then they'd continue to pay, in that option 6 example, their drug copays until they hit $2,000, and then they'd be done for the year.
So in option 5,
Completely removes that
there's
middle
no
layer.
insurance, but so what's coming under your out of pocket then?
The co-insurance and copays combined. So
they're just combined.
Yep.
Okay.
Exactly. So they hit that in option 5, the $500 deductible. They'd pay 20% up to $5,000, and then once they hit the $5,000, they're done for the year. And if you were to offer 5 and 9 as a dual option, the final financials would depend on who enrolls in what, right? So it's going to range anywhere from about a 1.2% increase to a 1.2% decrease. It's going to fall in between those two depending on how many people enroll in those options.
And then the estimated annual change would also be entirely dependent on how the enrollment went.
Exactly.
Okay.
Yeah.
But it would likely fall between those.
It would
two
fall
brackets.
exactly. So if you had 100% of people just enroll in the 1,500, best case scenario, you're going to save 1.2%.
Okay.
Probably going to have somewhere in between. Page 6 looks at the disruption from moving drug formularies. And so that is the Results RX formulary. Kind of have highlighted off to the right-hand side. 94% of the claims that have been filled this last plan year wouldn't be affected at all. So there'd be about 6% of claims that would be disrupted. When we look at total number of utilizers, 80% wouldn't be impacted at all. So that means that there'd be about 20% that would have some type of impact, whether that's a negative drug tier change, so they're going to have to pay a little bit more for their prescription, or that drug is completely excluded. But Blue Cross will always have some type of alternative medication that they can continue to fill. It's just they can't get that exact drug that they're currently taking. And if you were to go this route with the Results RX formulary, all members would receive communication well in advance of this taking place, so they can work with their doctors, show them the letter, say, hey, this drug's not going to be covered on our plan anymore. What alternatives would you recommend for me? And if you look at that, the chart on the left-hand side, you can see kind of where everything falls. And so in that negative row, what that means is they can still fill the medication. It's just going to be a higher drug copay. And then the excluded, obviously everything falling in those buckets are excluded from the plan, but you'll see most of them fall in that bucket 3. And what bucket 3 means is there's over-the-counter availability. So these are probably low disruption claims that would be falling out because there is an over-the-counter available medication. Any questions on that piece? So the next few things wanted to just touch on briefly is Freedom Choice. They're also here today, so I'm sure they could talk through some of this or answer some additional questions. But really, this is just kind of an alternative way to fund the health plan. And so really what it does is you as the county would purchase essentially an umbrella policy. So it'd be a $6,000 deductible plan. So that's kind of your umbrella policy. On the employee side, this is showing it mimicking your current plan as it is today. So they'd have a $200 deductible. They'd have a $500 after that deductible for a total of $700 total out of pocket. And so what that does is by you purchasing that umbrella policy, it's a $6,000 deductible plan. You're going to pay a lot less in premiums for that. But what you're going to have to do as the county is fund any portion in between. So member hits their $700 out-of-pocket maximum, you're essentially going to pay those claims up to that $6,000 deductible. And so it's just a different way to fund the health plan. Essentially, you as the employer, your maximum liability would be $5,000 and $300 per member on the plan. So you're just taking that difference between the $700 out-of-pocket and the $6,000 umbrella plan. Page 8, kind of just wanted to show an illustration of where your renewal with Blue Cross, where we'd anticipate costs to come in at versus some of the Freedom options, because at the end of the day, the Freedom, it's all going to depend on how many claims you pay in that kind of middle bucket for it to make sense. And so you'll see on the left-hand side, we have the Blue Cross ASO renewal. Breaking out all of your costs, the current renewal has, based on the 201 employees enrolled in the health plan, an admin cost of $155,000. Stop-loss premiums are $851,000. And so you kind of add those two buckets, that's your fixed costs as a self-funded employer. The rest of the claims are going to be the rest of the costs are going to be your claims expenditures. So right now we're expecting medical and pharmacy claims to be about $4.3 million. You do have the international sourcing program that's running kind of outside the plan. So I wanted to incorporate those claims. It's about $280,000. But you also have pharmacy rebates that you get every quarter, which if we annualize your last plan year, that's $392,000. So we want to take those out. So when we look at where we'd anticipate your total costs to be on this upcoming renewal. It's about $5.1 million in total costs.
Is that using our current grandfathered or one of the other options we're looking at?
We're just using your current grandfathered in this scenario just because the Freedom proposal
Use the same numbers.
using the same
Okay.
numbers.
All right.
Yep. And so when we look on the right-hand side, the Freedom admin costs are going to be $130,000. That's based on a $54 per employee per month fee. The umbrella policy, so that's going to be your $6,000 deductible plan that you're purchasing, is $4.2 million. And so you add up those two costs, and that's going to be kind of your fixed costs in this style of health plan. And so really that question is the MERP claims, that in-between layer, where you're going to fall there. So kind of best case scenario, it's not really going to happen this way, but let's say you don't have anyone that hits their $700 out of pocket. That means you're not going to pay any MERP claims. And so best case scenario, it's about $4.4 million, which is pretty substantially lower than the Blue Cross renewal. But again, based on your utilization, you're going to have some people fall in that middle bucket. When we look at kind of a break-even figure to get you to that $5.19 million number, that's $794,000 in claims in that middle bucket. That would essentially be your break-even point. So you'd want to fall below that number. And then from a maximum standpoint, what we did is showed the fixed costs, so the admin at the 130, the umbrella policy at the 4.2, and then your maximum liability as the employer would be that $5,300 per member. You have 500 members on the plan, and so that's how we got that 2.65 million number.
That's if everybody hit the peg.
And so in order for that to happen, everyone would have to hit that 6,000. Again, that's probably not going to happen either. You're going to fall somewhere in between there. But just wanting to show your maximum liability. So that's that $7 million figure compared to, if you look at the Blue Cross self-funded renewal, your maximum cost would be $6.27 million. And so how we got that is your fixed costs, you're a fixed cost. You're going to have those regardless. It's really just taking that medical and pharmacy claims bucket, that 4.3, and taking that times 1.25. That's your ag corridor. That's the stop loss protection that you pay every month in order to have aggregate stop loss coverage. So that's your maximum liability. It is also assuming that IMARX claims and the pharmacy rebates are at expected too. So it's really just looking at that medical and pharmacy claims at maximum liability. And so it's kind of difficult to predict where employees would fall in that middle bucket. So what we did is just to give some sort of estimate, right? We looked at, based on your last 10 months of utilization, what were every single member on your health plan, what was their allowed amount? And so the allowed amount is the total cost of the claim before you take into fact any member cost share, essentially. And so you had 293 members above $700 in an allowed amount. So that means that when we looked at this, and I looked at every single member kind of on the plan and each of their allowed costs, and we kind of zeroed out everyone in that analysis that was below $700 in an allowed amount, because we know they're not going to hit their out-of-pocket. You're not going to pay MERP claims on those individuals. And then what we did is looked at all those members that were above the $700 and essentially subtracted out $700 because that'd be their member cost share. And then whatever amount that they were above that, those would be the MERP claims. And then we capped it at $5,300 for each individual because that's your maximum liability. And so when we got to that figure, it totaled about $900,000 in MERP claims. It's not the most accurate way to look at this, but it's kind of the best way we can do it, because you're going to have some claims that are allowed claims that don't go to member cost share. So we wanted to give kind of a range. So looking at 75% of that number, it still came into $823,000, which is above that break-even point we were getting. And so a lot of this is being derived from that umbrella policy. Those premiums are still, if you remember when we looked at the fully insured rates, they were quite a bit expensive just keeping your plan the same. So even though you're looking at a $6,000 deductible plan, that umbrella policy, those premiums are still pretty expensive. Another thing this doesn't consider is this would move you to technically a fully insured chassis. So the IMA pharmacy program would go away. All of those pharmacy claims would fall back onto the health plan. So then your next renewal, that $6,000 deductible fully insured renewal, is going to be, I mean, we're talking $400,000 or $500,000 in claims that are going to come back onto the health plan. Any questions there? Exactly. That's the other component of it. Yep, is they're getting their drugs for $0 now. They would have to pay the full cost of those prescriptions. Page 9, pretty simple. Dental renewal came in good, 2.9% decrease. We didn't look at any plan design alternatives there. So pages 11, 12, and 13 is when we start to get to some of the contribution illustrations. We have 3 that we put together. Page 11 looks at your medical and dental renewal combined. It is keeping you at that grandfathered plan. And what we did here is, in a grandfathered arrangement, you kind of have a maximum contribution that you can pass along to employees. And so what we did is set that at the maximum contribution. So it'd be about a $12 per month increase for an employee only, and then $203 per month for a family. That's the maximum that you can pass along in a grandfathered arrangement. And so that'd be, in total, about a $302,000 increase to employee contributions when you look at the 82 employee onlys and 119 in the family tier. Contribution illustration 2 on page 12 looks at that dual option. And so we're calling this kind of the benchmark contributions because when we looked at the benchmark analysis and what some of the other public entities in your area are doing, this is really just kind of mimicking their exact contributions. So the $500 deductible would have a $283 employee-only contribution. The family would have an $841. And then on the $1,500 deductible, it would be $101 for an employee only and then $400 for a family.
Are these fixed rates on the employee contribution, or are these variable?
On the employee side, those would be fixed, yeah.
So those are fixed by the plan?
Yep.
Okay.
And so, as we mentioned earlier, it really depends on migration and what the final kind of numbers look like. So since it's a pretty substantial change on that $500 deductible plan and increase to employee contributions, we're showing about 75% of folks going to that $1,500 and then only about 25% remaining on the lower deductible, the $500 deductible.
Is that kind of based on historical data and similar situations, or just a guess?
It's really just a guess.
Okay.
That migration is so difficult to project because every employee in their financial situation is different. Especially looking at you guys with your grandfather $200 deductible plan and knowing that we're probably going to have to do an employee contribution increase this year, it's very difficult to project. I would say usually when I look at, like, let's say you had the $500 deductible today and you're looking at like a $1,500 deductible, I'd probably only assume like 20 or 30% would migrate to that plan, but it's all based on the contributions and what you set that. So I feel pretty strongly that at least more than half would opt into that higher deductible plan because of the contribution difference. And then on page 13, we have the same dual option, but it's a little less aggressive on the employee contributions. And so the $500 deductible plan would have a $95 employee only and then a $450 family. And then the $1,500 deductible, what we did there is actually keep those contributions the same as they are today. So that way that employees still have an option that they can pay the same that they're paying today. They're just going to have a higher deductible. On the $500 deductible, if employees really want that rich, low deductible, then they're just going to have to pay a little bit more for it. It's a pretty standard plan that we see is kind of a base and buy-up scenario to where it gives employees choice. And it still does kind of inch closer to more of a standard or benchmark plan and contributions.
So I think you misunderstood my question on the last model, number 2. So the employee contribution rates are adjustable, and we set those, not the plan.
Yes, sorry. I thought you meant throughout the year. So throughout the year, they're fixed. You're going to pay that every month no matter what. They're completely adjustable on
dollar
your
amount
guys' side on
is
what you want to set.
Determined by us.
Exactly.
Okay.
So that's where it kind of flows into the budget conversation, which is on the next few pages as far as what you all think you can do from a budget standpoint, and how much of that increase do you want to pass along to employees. So page 15 looks at the current budget for the 2026 plan year. It is on a calendar year, so the budget's different than the plan year. The plan year is 5/1. Budget's on a calendar year basis. And so these were the financials that April provided to us, to where you're accounting for $850,000 for your essentially Blue Cross admin fees and stop loss fees, $4.9 million in claims. And so that total cost is $5.8 million. That's without taking into effect any type of contributions. And so what's in the budget today for contributions is $578,000 for an employee. And so when we look at kind of the net cost to the county, it's that $5.2 million. So looking on the right-hand side, we're just showing where we're anticipating costs to finish at based on kind of the 3 illustrations that we're looking at. So that first column is looking at your renewal, the grandfathered plan, and raising contributions to max. And so what we did here is showed, based on January through April, your current costs, what those are for that 4-month time frame, and then what the renewal came in at the remaining 8 months. So lining it up to a calendar year to match your budget. And so when we incorporate rebates, claims, fixed costs, kind of everything involved in your health plan, that came out to $5.2 million. If you were to raise employee contributions to that maximum amount, it'd be $749,000. And so the total net cost to the county would be $4.5 million, which is about $700,000 less than where the budget's currently set.
Okay, Nick, so that's going back to this contribution model 1.
Correct. And so
And raising the employee contribution to 67.
exactly that first illustration, to where it raises it to $67 for an employee only, and then $538 for a family. And that's only 8 months of that, right? Because of where your plan year
And
falls.
deductible stays at 200.
Deductible stays at $200.
Okay, I'm with you.
Yep. That middle option would be the dual plan option, and that was the one that was a pretty significant increase to employee contributions. And so that option, the total costs came out to $5 million, and that savings is just coming from the plan design change, right? And then $776,000 in employee contributions to a net cost to the county of $4.2 million, which gets you pretty close to that $1 million decrease under where you're setting your current budget. And then the final option would be moving to the dual option, and then a little less aggressive on the employee contributions. And so that came out to $5.0 million again. The financials are a little different because, again, we're looking at different migration numbers, if you remember. And then $616,000 for employee contributions to a net cost to the county of $4.4 million, which is just under $800,000 below where the current budget's set.
What accounts for the difference between the renewal employee reimbursement and illustration number 3 employee reimbursement?
Yeah, so those are the contribution illustrations that we just walked through. And so that's the differences there. The renewal is looking at the last 4 months of where current contributions are set at, and then the proposed illustration rates based on the renewal of $67 for an employee only and $538 for a family.
But the contribution rates are going up, but we're showing a lower number.
Exactly. So the contributions are going up. So like on the renewal, that's I guess what do you mean lower number?
The reimbursement's going from 749 in illustration 1 to 616 in illustration 3. I was thinking it would be something other than that.
So it's because the family premium. So in illustration 3, both of the family premiums are at either 450 or 335. And then you look at illustration 1, that family premium is 538, so it's actually more expensive.
Oh, okay. I thought you were talking about the grandfathered plan there.
So
One is the grandfather plan, right?
one is the
So
grandfather
that is the
plan.
grandfather.
With the
Yep.
increased in employee contribution, right?
Yep.
Okay.
And so really that illustration 3 has a less rich plan design. So you're getting more savings there. You're seeing less in employee contributions because it's the least aggressive from an employee contribution standpoint of passing along that increase. So that's why that number is the lowest. And then another thing to consider is historically you've budgeted at kind of worst case scenario. So I wanted to show you, if you were to budget at any of these marks, where do you kind of fall on that? Are you funding at expected? Are you funding at maximum? What's kind of the delta? So that way you guys know what your liability is. And so that's what's on page 16. We have your total cost at expected at that 5.837 million. We look at the renewal where we'd anticipate costs to fall in your renewal. That'd be that 5.2 million. So you'd be kind of over budgeting where we anticipate costs to be at essentially $500,000. You'd be funding at 110%. Worst case scenario, you'd have to come up with $516,000 if you ran worst case scenario. And so that's what that's illustrating with the renewal. And then the two dual options, we did the same exercise. Because you're making those plan design changes, we expect claims to go down. You're budgeting a little bit higher there. So that came in at 115% of expected costs, or you have a buffer of about $781,000. That means you'd have to come up with about $230,000 if you ran at worst case scenario. And then it's really the same for the other one. The financials, again, are just a little bit different because of how migration might shake up. And so in that last option, we're assuming less people migrating to that $1,500 deductible because the contributions are a little more favorable. And so that's why that option's a little more expensive, because more people are in the 500. Any questions on the contributions or budget pieces?
Actually, a question for Angela. Out of these total costs, what percentage of these are reimbursed from landfill and rural fire and other things that actually reimburse us, so that we know true cost?
I would have to look at the numbers. I don't have that number.
Those are numbers we're going to need, I think,
Okay. You got 'em?
just so that we know what the actual cash outlay is versus the reimbursements.
And that's all we really had for our presentation today. We have a quick kind of decision matrix on the last page. I don't know if we want to walk through that now or wait till later, but
And on your page 18, I mean, looking at we can certainly explore options that fall somewhere in terms of the employee contribution, fall somewhere between options 1 and 3, correct?
yep.
Okay.
That's completely, you guys can set that at your own discretion, just whatever you can fit in your budget.
And you can help us where you think
Exactly.
that might go. Depending
Yeah,
on
so
what
if we
goes
have
on.
more follow-up after this, happy to run some more illustrations, more
Okay.
numbers.
We can't change option one.
That is true. So
Correct.
option one is technically set at the maximum. So yeah.
So we can change option 2 and 3, but not option
Yeah.
1
Option one, the only thing you'd be able to do is make it
to the max.
smaller for the employees. So you would be able to change that if you wanted to do that. So I think we set like family contributions at $538. If you want to do like $500 instead, we can.
Can't go up.
Can't go up. You
That's
can go
the
down.
maximum amount.
Yep.
Questions?
I know it's a lot.
Just a question, because it's taken me a while to kind of wrap my
Yep.
head around the Freedom Choice product.
Yep.
Is that compatible with a portion of that being self-insured? Because what we're showing is a fully insured plan.
This is my opinion, and they can speak to it too. The way that I look at it is you're already self-insured. You're already paying for claims as they happen or they incur. This just kind of adds another layer of complexity to it because it's kind of a mini self-funded plan. At least that's my opinion. Where I typically see these types of plans and where they're really effective is you have a group that's currently fully insured. They are maybe either very conservative, they don't have the funds to go self-funded. They do something like this as a Kickstarter to get them self-funded. They
And
take
it's
their
limiting their risk.
yeah.
Okay.
So that's where I typically see these types of plans be effective. I just think that since you're already self-funded, you're already paying for claims as they incur. And then the IMA pharmacy piece of it, we're talking about $400,000 in rebates you'd be losing.
So that's not possible through the other.
If you did the self-funded piece of it with Freedom, yeah, you could do that. But if you did the fully insured, like was quoted, then you're losing the $400,000 in rebates. The pharmacy program would go away. So yeah.
Questions? Ira? It's a lot, I know.
Yeah, it's a lot. I'm just kind of trying to wrap my mind around it. Yeah, I don't have anything right now.
Okay, John?
I think I'm with you.
So, going to the option 5.9, which is the most savings that we can bring, we're only saving $250,000 over their existing plan, the grandfather plan. This 700,000 versus 979. Is that right? I'm on ER cost illustrations.
What page, John?
15.
Is that 50?
It doesn't have a number on it.
Yeah, I number mine, 15 or 16.
It's about $200,000 in savings from moving from your renewal at your current plan design to moving to the dual option. You'd save roughly $200,000 in premiums because we'd expect claims to go down because members have a higher cost share.
And that's the overall cost to us.
That's what you'd be saving instead of renewing as is. So really the overall cost to you all with the contributions included is kind of that last row. So budget's at that 5.2 million. We'd expect the renewal as is, so no plan design changes, but increasing contributions, you'd be about $700,000. You'd have about a $700,000 buffer between running at expected and where the budget's at. So that's what those kind of illustrations at the bottom show.
So what's accounting on that page? There's a Oh, wait a minute. I'm reading the wrong year here. Never mind.
So with, on page 16, which is, I mean, it's 15 and 16, yeah. So the net on option 2 would be 979,000, correct? On page 15.
Yeah, that's the illustration I was looking at.
So that would be the amount under the budget where we'd anticipate costs to come in at.
Right.
So,
and the option 3 is 799.
yep.
And so then page 16, the budget versus expected.
Yep. So that doesn't take into account any of the contributions, because when we're looking at that number, we want to look at total premium. Whether you pass along 749,000 for employee contributions or 616,000, it doesn't really impact how you're funding the total health plan. It's just essentially that means that you're going to pay more or less as the employer. So wanting to look at total premium amounts, and so that's what we have illustrated on that 16.
So page 15 would be the net to the county.
Correct.
If we based on your employee contributions and the options 5 and 9.
Exactly. That's the true net.
Understanding it's not exact, not knowing people.
Exactly. These are all assumptions, right? It's based on projections of how you ran the last 3 years, and yep.
But am I understanding that right? That our existing grandfathered plan is only going to cost $200,000 more than going to the best plan you can give us.
Yep.
If you raise the employee contribution.
If you max it out.
Even without considering employee contributions at all, it's about a $200,000 difference, because your renewal got a 6% increase. These options are about flat, and so that's going to be your savings without even considering any from the renewal. At least you're still going to have similar costs to what is today, essentially, because you got to account for if you were to renew in that grandfather plan, we'd anticipate costs to go up 6%.
So if you continue with the $200 deductible under the grandfathered plan, you're going to continue to expect more claims.
Exactly.
Lower brackets than if that deductible goes up.
Yeah.
And that ultimately is a cost to the county.
Yep, exactly. So,
and that will impact us going down the road by lowering
because it's
claim.
year over year, right? So you keep that $200 deductible, you're paying. So if you flip to page 5, I think page 5 does a better job of showing what we're talking about, plan design savings. So if you were to renew in the $200 deductible grandfathered plan, we'd anticipate costs to be going up $312,000, which is about 6.3%. It's that second column on the chart. So that's your increase if you make no changes at all.
Yeah.
And that's going to be, when you look at options 5, for example, that lowers the increase from a 6.3 to a 1.2. So it's $255,000 in savings over the existing plan. But to your point, you also got to think of it year over year. We're going to anticipate lower costs every single year because members have a higher cost share. So that's where the savings are coming from.
So there is we don't know what it would be, but there would be a compounding effect.
Right. So like, let's say next year, if you wanted to quote this $200 deductible plan, it's going to be $255,000 more. So you might still have an increase next year if you move to the $500 deductible plan, but you'd have a lot more of an increase if you stayed in the
grandfather
exactly
plan. Yes.
Yeah. So that does kind of compound over time.
It's based off of prior 3 years, correct?
Exactly. Yep. There's really 3 main cost components of a self-funded health plan. You have your admin costs. So that's a fixed cost. Blue Cross has passed a rate pass in that category for really the last 3 or 4 years. You have your stop loss premium. It's another fixed cost. And then the claims, which make up the majority of your health plan costs. That's where we look at your last 3 years of utilization, apply trend to it to project forward because costs are going up, et cetera.
So even though we're going to project some kind of increase going forward, no matter what plan we do,
it's still going to be less than
if we no longer have the grandfathered plan, our look back at the end of 3 years is going to be significantly different.
Right. And we can look at that too as you move to, one of these other plans, we can always do a look back to say, you saved $250,000 this year, but then that kind of compounds over time and to see what that number is.
So that is an additional way to put some cost control into the
Exactly.
overall plan.
It should carry forward and should decrease.
It's also,
The 3-year average, the rolling average, should decrease every year after the first year.
yeah, it's also going to teach more consumerism with members on the health plan. So they're really going to think about where I go. Am I really going to go to the ER because I got to pay a lot more? Am I going to go to the urgent care now? So it kind of tweaks some trends to where that can be a little more beneficial too.
And we can help that just with
Through communication and yep. But right now they have a $700 out of pocket. They hit that. Who cares where they? I mean, they're going to go wherever. Yeah, I mean,
All these options have telemed.
yeah, you'd still have the telemed, and all these options too. An enhancement would be they get their preventative care covered at 100%, to where now they have a cost share with that. So you're incentivizing them to make sure that they're getting their screenings, which catching a cancer in an early stage versus catching one in a later stage, both is better for the employee or their family, but it also saves money because there's less aggressive treatment.
Angela said she has those reimbursement numbers.
So for landfill, it's $491,856.85. Waste haul is $628,542.16. These are 25 actuals for a total of 1.120,399.01. And then for rural fire, the projected 26 R&R number is 354, 451 and 66 cents. Together, those sum to 1.474, 850 and 67 cents. And if you go to page 16, I've already taken that out of the 3 expected maximum costs. So if you're looking at the renewal from 5.284, it's going to take that down to $3,810,115.33. If you look at the first dual option, it's going to go from 5.056 million to 3,581,250.33. And the last one will go from that 5.075 million to 3,600,861.33 for your overall cost.
Angela, did you include community corrections and JCAPs? Because they reimburse as well.
No, I did not grab those numbers. So it will be then even lower. We don't have those numbers right here.
Anyway, they reimburse too.
Do you have those?
So that's closer to the number we have to look at on the, as I follow it, on our actual working budget, because those other amounts are reimbursed or paid separately from those other departments.
And I would assume
Is
you
that right, Angela?
take the max and roughly add
Yes.
$1 million to it.
I mean, that's what I was kind of thinking. And that's also another conversation with, you've budgeted at maximum liability because you don't have necessarily a reserve. I don't know this could be a year to where you take whatever you run at a surplus, throw that into a reserve, and then we also look at next year buying down the renewal. That's what most of the self-funded plans that I work with, how they operate, is they set aside reserves. So in a surplus or favorable year, they have a reserve built up. That way in a year to where you get a 10 or 15% renewal increase, maybe you only take a 5 or 7% because you have a reserve built up.
The budget last year, Steve, was max minus $1 million, right? Is what went into the budget.
With some reluctance, we reduced the set aside. Yeah, I think it was $1 million
Budget
below
number
where
was
it
the
started.
max minus $1 million, somewhere in there.
Yes, I believe that's right. Is that right, Steve?
I thought it was $1 million
$1.5 million?
off of employee benefits. It was $1 million. I thought it was $1.5 million.
Okay. It's one or the other. I don't remember which.
I'm pretty sure it's
But if you took the reimbursement that Angela just read, and it looks like most of these are $1 million, so added $1 million back to that for worst case scenario. So 3.5, 3.6 plus $1 million. Am I thinking right? That'd be worst case scenario.
Yeah, like the 4.8 million, essentially.
But I think our reserves or funds that haven't been spent in the past have just been rolled into the general fund reserve. They haven't remained in the
I think April mentioned there is a small amount that they keep in some type of claims reserve, but yeah.
Well, it stays within the employee benefits. It just reduces the taxable amount the following year.
Is that how we've been treating it?
So all those are. I may not explain it right, but it just reduces.
We're reducing the levy the following year.
There you go.
Okay.
Yes.
Because we never have spent,
Right.
the amount we have to budget for,
Right.
just in case.
We come down. Okay, so, excuse me. So anybody have any questions now that we understand this better? Anybody have any questions of freedom claims?
If Julie had anything she wanted to add to what we had discussed, since she came here, I'd give you that opportunity.
Cost and looking at
Thank you.
that there's basically three. You got your cost, you got your claims, and I've done an illustration based on expected, based on maximum, and based on
Thank
your actual claim. I'm Julie with Freedom Claims, and this is Hadley. So with putting together the illustration. Basically, you're shifting the risk and limiting your liability by doing the Freedom Choice Plan. Yes, you're going back to a fully insured umbrella policy with a $6,000 deductible. You're designing those underlying plans. We did show a $200 deductible plan. We mirrored your current benefits. I also put in a $500 deductible because underneath that $6,000 deductible, you can design plans. So you can have 2 different plans or 3 different options under that high deductible. So yes, your fixed costs go up more so than your self-funded, but the maximum liability is $6,000, not $125,000. We've had some groups that's been on a self-funded plan that go back down to the Freedom Choice Plan, the high deductible medical expense reimbursement plan, to pull those claims that you've had that are out of control, pull those back in. So we can do the office visit copays, your deductible coinsurance, that underlying plan that's in blue on the sheet here, it would be the second tab in. These design here in the blue is designable by you. So you can pick your deductible, your coinsurance. But the first 3 pages, and not knowing what numbers there were, so I just took the Blue Cross renewal, looked at expected, looked at maximum, and looked what your actual costs were compared to the medical expense reimbursement plan. And this is based on 82 single and 119 families. So up here is expected. So if it is sold on expected, and we always hope that we can keep those claims at expected or less, going through what your annual aggregate is, that is your claims. So you can tell your claims liability is less because you reduced your risk from $125,000 down to that $6,000 high deductible. What your annual fixed costs are, what your aggregate is. So based on expected, yes, what you're currently doing is 9.86% less than doing the MERP. But I always look in worst case scenario, if the ceiling failed, you have your maximum numbers, which is your second page. So again, the Freedom Choice Plan with the high deductible, and again, these numbers are based on that $200 deductible. Your maximum costs come in at 7.79% above the medical expense reimbursement plan on maximum liability.
Julie, could you speak into the microphone, please?
Sure.
Thank you.
Maybe I'm a little bit taller. And then the third page is the actual. So we went through and we looked at your claims data from Blue Cross and Blue Shield, and the fully insured $6,000 medical expense reimbursement plan. Your total annual maximum cost there would be, and this is worst case scenario, if everybody on the plan met that $6,000 deductible times 2 per family, maximum liability is $6,060,000. On the actual, looking at your fixed cost and what your claims were, you're running at 5.81% above what the maximum liability would be on the medical expense reimbursement plan. And I took these numbers off the Blue Cross and Blue Shield renewal maximum.
Is there any way, because it was mentioned, any way in your package or under this Freedom Claims to marry into it a prescription plan, or is that just going to be something where we're no longer getting the reimbursement?
With it being a fully insured, there are no longer rebates under the plan. I was not sure in looking at the data, that's questions that we had for IMA, is the cost that you pay for that to get the rebates back. I noticed under the Blue Cross and Blue Shield policy that there were prescriptions paid. That is included in your stop loss, your fixed cost. Any of your prescriptions here would go towards that $6,000 deductible. And there's no rebates on a fully insured plan.
Okay.
Hadley, do you have anything to add? Okay. We're a third-party administration office out of Great Bend. We work direct with groups. We work through brokers, such as Nick, on putting plans together. Again, we have your fully insured cookie cutter plans. We do the medical expense reimbursement plan. And when Nick was talking about reserves, if you look at page 6, this just gives you an idea. Behind the first tab, page 6, I put this taking the plan design and what you currently have. Up here, it has Blue Cross and Blue Shield actual of the 125,000 stop loss compared to the Freedom Choice plan. Maximum liability on the Freedom Choice plan is $1,696,000. That's the most that you could spend in claims based on 82 single and 119 families. That would be what come out of claims. With what you're funding on what you actually paid in your fixed cost and your claims with that 125,000 stop loss, you'd be putting in $2,733,033. So you would be funding reserves at 105.93% based on what your actual claims were by doing the Freedom Choice plan. What our employer groups do is coming up with that premium, what the employee contribution is, what the employer contribution is, and they do set money aside in reserves. And as Nick stated, then it's those reserves to help offset any increases, to help with claims, but it works along the same lines as a stop loss, but now you just have that $6,000 fully insured plan versus $125,000 that you cover those first claims.
How does the look back work if you're, sorry to interrupt you.
No, you're fine.
How does the look back work if you've got a high deductible policy, but yet the county's covering a significant portion of that? Is the look back over the 3-year claims period still looking at total claims, or the part paid by the county or the part paid by the individual?
Well, both.
Okay.
Both. So on here, when you have, and like this illustration was done on the $200 deductible, so the $6,000. So the look back is, it's just like the detailed reports with Blue Cross and Blue Shield. We can run and tell you how many individuals had met that high deductible. I also included another illustration in there showing the $500 deductible. So basically, what that does is as you increase the employees out of pocket, it reduces the county's liability. So based on that $200 deductible, where we're looking at page 6, if you go back to page 3, we're saying based on the count and what your funding on what you've actually spent, 357.39 people would have to meet that $6,000 deductible to use up all of your reserves based on those premiums. And the prescriptions, you use the results RX formulary. We can set the copays. So when they go to the pharmacy, even though you're holding that umbrella policy of that $6,000, however we design that plan underneath, if they have a $10 for generic or a $0 for generic at the point of service at the pharmacy, then that's the copays. So we set the office visit copays, the prescription copays. We also do the telemedicine. We work with employer groups on wellness forms, very big into wellness. So whether, a fully insured or changing from a non-grandfathered plan, the 100% on preventive, I think, is an excellent tool to work off of for a wellness program for the employees. And we have a lot of our larger employers that do this, is everything on their wellness form is covered at 100% under the wellness benefit with Blue Cross and Blue Shield. They complete 5 of those. They get premium credit. They get HSA dollars. There's an incentive for them going out and doing this where it's covered at 100% anyway by Blue Cross. So we work with our groups on setting up the wellness programs because you're better off to be proactive than you are reactive. And that controls the hypertension before it becomes a heart attack. So that's it in a nutshell. But basically, you're just shifting your costs. Right now, you have 125,000 stop loss. And we do self-funded groups through Freedom Claims. You're reducing that liability from 125,000 down to 6,000 based on if you have 2,000 with the deductible and co-insurance of that 6,000, then the county's liability only becomes 4,000. So that's why I did the first 3 pages in there showing on maximum, expected, and your actual, because those are the 3 things that you look at. The worst case scenario, what's your maximum liability? Expected is easy to say. We can always say that everybody's expected to spend 80%, but we don't have a crystal ball and we don't know where those claims are going to be. So, and then we show on your actual claims, both on the maximum and your actual claims, the Freedom Choice showing maximum liability came in less than what you're currently on. Questions?
Okay, on page 4, I'm not really understanding the chart. It says claims between 0 and then it's 29%. So 29% didn't have any claims at all.
All right, I'm sorry. On which page are you
On page 4, right here, you said threshold claims between and then 0, and it's 29%. I don't understand that.
That is just basically saying based on the medical inflator, the claims that you're going to have, 29%. A certain amount of your employees are going to meet between 0 and 1,000. And actually, there's a report in your Blue Cross that tells you, then anybody that met claims from 5,000 to 10,000. This is just telling you the percentage of where those claims are going to be.
Okay, so you're saying in between 0 to 1,000? That's not how I read it on the chart. I'm sorry.
I'm trying to see where you're at.
Okay, on 4, I just don't get it because it's $1 to 500, and then you say it's 24% of the group. But here you're saying that 0 is at 29% of the group.
Right. So based on your members, there's a total of 320 members.
Mm-hmm.
So the members that are going to meet 0 claims is 29.82%. So there's going to be some people in your plan that do not meet any dollars. So from $1 to 500, 24.13% of the employees will meet anywhere from $1 to 500. And then 500 to 1,000 is 18.88%. This is just telling you where your claims are going to fall. Between 2,000 and 2,500, 3.26. So this is saying that based on your plan over there on the numbers, it's calculating the members for the percentage that actuarially speaking, 22.85 people will probably meet that $6,000 deductible in claims. And we're saying that on the other page that 357.39 would have to meet that $6,000 deductible for it to break even. And actuarially speaking, we're saying 22.85. So that's just telling you that based on the percentage of this number of lives is who's going to meet claims within that. So roughly 22.85 people will have high dollar claims or above $1.
But historically, we're running ahead of actuarial. Right? That's just
This is based on the $6,000 deductible, yes.
right.
So
That's how it should break out. But
Yes.
we've historically been higher than
So
that.
like last week or 2 weeks ago when I came out here and we showed you, we used the scenario of based on your group size, actuarially speaking, you were only supposed to have like 20 members above $25,000 claims. You had like 47.
Yeah.
So from an actuarial standpoint, you run hotter than that typically.
Then that chart would show.
The other thing I want to point out is they have 500 members on their health plan, not 320.
It's because this is
2 times.
so you're right. But on a family, if you've got a husband, a wife, and 6 kids, there's only 2. So your liability times 2. Like
Yeah, I see what you're saying.
So there's
it's
320.
just a max liability cap.
Right.
Because we had, trying to think, we had like the ones that were over 125,000 this year.
What was that?
The claims over 125.
I think there was like 2 or 3.
I thought it was 7. Yeah, 6 or 7.
Because you're running better this year.
Yeah, I thought it was 3.
The Blue Cross reporting, I showed 2 over the 125,000. There were 6 people that met at least 50% of that.
So two are above 125,000, 6 are 50%. 50%. That's typically where we start tracking it. That's 62,500. But there are only 2 that have hit the 125,000, which when you look at a self-funded plan, you typically see 3 to 5 people hit your stop-loss deductible. Pretty standard. So you're really kind of right in line with that. Now that is year to date, right? So we're only looking at, in this report, we're looking at May through January.
And this is talking about the 2 on there is that 125,000 this year, actuarially speaking, is based on the 6,000, which would be the on $1,000 deductible, 1,500 out of pocket would be only 4,500 for you as an employer before it reaches that threshold of 6,000 that then is covered at 100% of covered in network expenses with Blue Cross.
Any more questions?
All right. Thank you.
Thank you.
Any more questions of Nick?
Maybe a question was.
We-
I'm trying to think. Make sure I'm clear on this. Was the reimbursement that Angela said is that number? How's it in the budget that we're trying? Is it with all the reimbursement, or is that the whole number that's in the budget? That makes sense what I'm trying to say.
The number in the budget is everything, and then from that you'd have to subtract.
So the number in there, you've already that number in the budget,
Would be the gross number.
not the net number. So we really can't compare what her reimbursement number is to the budget number.
No, but I thought we just needed to know
Okay.
how much of
Okay.
this
I
is
was
actually
well. I was making
paid
notes.
from other
I was
sources.
confused. I was
Yeah.
gonna be less. Okay. I'm clear. Got it.
Okay. Any more questions, comments? We got,
How do you want to proceed with this, Steve?
well, we can't take action in
I
executive
know.
session. So, I guess we can talk about it on item 11.
What's the date? The date to make a
You
change.
need to know shortly.
You got to start enrollment by the 1st of April.
Or the end of this month. I mean, it's
Yes.
possible, right?
Yep.
So this meeting, we need to.
So we have to have another special meeting.
I think the sooner the better from our standpoint, because, you know, happy to assist with open enrollment however we can. I mean, within a week of open enrollment, I feel like we can get things rolling on that side.
And that's
The plan is like from Blue Cross's standpoint, as long as we're within a month or so of your effective date, that's ideal because that way employees can get their ID cards and all that information in time. You can still run it later. It's just they might get their ID cards after 5/1, which they can still give them their social. And they can get it online, but the actual physical cards mailed to them.
So we can talk about it Sunday night. If we got to have a special meeting to finish it up, we can. Okay. We got a motion to adjourn the work session.
So moved.
Second.
I will.
Have a motion by Commissioner Stanton, a second by Commissioner Lauterbach to adjourn the work session. All in favor, raise your right hand. Motion passes 5-0.
Thank you.